How does MRI show subtle stroke changes in the brain? Have you ever wondered how doctors can spot subtle changes in the brain after a stroke? Magnetic resonance imaging, or MRI, plays a crucial role in this process. It detects changes in the brain by examining how water molecules move and how brain tissue behaves during and after a stroke. This is especially important because some changes can be tiny and might not show up on other imaging tests like computed tomography scans. One of the key MRI techniques used is called diffusion weighted imaging. This method is incredibly sensitive to the movement of water molecules. When a stroke occurs, the cells in the affected area become injured, which restricts the movement of these water molecules. On an MRI scan, this appears as bright spots where the stroke has happened, often visible within minutes to hours after the onset of symptoms. Another important technique is fluid attenuated inversion recovery imaging. This method helps doctors determine the age of a stroke by showing changes related to increased water content in the brain. After a few hours, this increased water content can be seen as areas of heightened signal intensity on the scan. When doctors see a mismatch between diffusion weighted imaging and fluid attenuated inversion recovery results, it can indicate a very recent stroke, often within a 6-hour window. This information is vital for making treatment decisions, such as whether to use thrombolysis, a treatment that can dissolve blood clots. In cases of subtle or incomplete ischemic injuries, MRI can reveal changes that indicate selective neuronal death and gliosis, which is a type of scarring in the brain. These changes can show up as specific patterns on different MRI sequences, allowing doctors to identify mild ischemic damage that might be missed by other imaging methods. When it comes to hemorrhagic strokes, MRI is also very effective. It can detect fresh bleeding in the brain, appearing as bright or dark patches depending on the imaging sequence used. This capability helps doctors understand the location and extent of the bleeding, even if it is small or subtle. Advanced MRI techniques can even assess the integrity of the blood-brain barrier, which may be disrupted during an ischemic stroke. Specialized contrast-enhanced MRI methods can identify small abnormalities in this barrier that other imaging might overlook, providing deeper insights into the stroke's pathology and progression. In summary, MRI is a powerful tool that shows subtle stroke changes by detecting early water diffusion abnormalities, tissue biochemical changes, edema development, selective neuronal injury, and blood-brain barrier disruption. These imaging features enable healthcare professionals to diagnose strokes earlier and more accurately, assess their severity, estimate the age of lesions, and guide timely treatment decisions. Always remember, if you have concerns about strokes or brain health, consulting a healthcare professional is essential.